To kick off our forum, we're really delighted to have Dr. Jessica Lueck, who is from the BPI group in Chicago. Jessica has a master's degree in mental health counseling and behavioral medicine from Boston University and her PhD in business psychology from the Chicago School of Professional Psychology. Her dissertation was on the relationship between spirituality and burnout. She currently works for BPI as a manager of transition and change, which is a key area, obviously, for us in medicine today. She's worked across industries, supporting organizations, teams, and individuals as they navigate change. A big part of leading change is having emotional intelligence to perceive how you and your team is responding to change, and that is what she'll focus on today with a very engaging and interesting program. So welcome, Jessica.
Good morning, everyone. Let's try that again. Let's get some energy. Good morning. All right, that was a little better. We're warming up. We're getting our coffee in for the day. Brian, thank you so much for that lovely introduction. It certainly gave a good sort of overview of my background, but I want to share with you a little bit about my journey just to give you some context. So as Brian mentioned, my background is in psychology sort of through and through. I have my PhD in business psychology, but first I got my master's in the clinical realm. I found myself working a lot of jobs trying to make ends meet in that industry, right? And one of the things I did was, psychiatric emergency services evaluations. So some things I'm sure we have in common and some stories we can swap today related to that. But what I found in the mental health industry was that there were a lot of things going on that almost made it really difficult for people to get well. That there were larger systems at play that I kind of couldn't combat as an individual contributor as a therapist. And what ended up happening with that is I also had managers who weren't equipped to lead. They weren't trained on how to manage people. And so all of these things, right, were a recipe for, guess what? Burnout. I found myself in this situation, totally burned out, trying to do a little soul searching and figuring out that I needed to go back to school to look at the larger systems at play and to help solve these greater issues with leadership today. So that's why I've transitioned into consulting. I work with this company called BPI Group, as Brian mentioned, and we are the leadership, talent, and transition experts. We're a boutique consulting firm based out of Chicago, and a lot of the stuff that I do is really related to talent development and change management and how we as individuals and organizations can better navigate the world around us to have the best outcomes. So emotional intelligence is one piece of this. It's one lens, one avenue that we can look at to think about how we can be more present, aware, and better leaders. So for today's workshop, we've got a riveting 90 minutes for you, and we're going to go through some concepts pretty quickly because I do imagine that most of you took a Psych 101 class at some point. Most of you have probably heard the term emotional intelligence, and so we're going to lay some groundworks. We're going to talk about what it is and why it's important in healthcare and leadership, and then we're going to get into some strategies, some ideas that you can use to harness and enable your own emotional intelligence, as well as these kind of tools and strategies that you can take back to your teams and lead with. We're going to look at your own emotional intelligence survey. So many of you did have the opportunity to take that prior to the session today. If you did not, there are a couple of the assessments on your tables, and if there aren't enough, there are extras of all the materials over here. So if you find yourself missing the quiz or the workbook for today, if you happen to fill in the back somewhere, we do have these workbooks up here, so please feel free to either fill in on these front tables or do grab one of those so that you can take notes as we go. And the emotional intelligence quiz is just a quick self-assessment that we'll want to make sure you have your results for as we get later on in our session and we start to look at case studies and practicing some of this. So for today, it's really important, as Brian mentioned, that you lean in and that you participate. Someone asked me about confidentiality of the quiz results and things like that, and I think that's a really important thing to note today, that this opportunity today to talk about your emotional intelligence is for you. And so the more honest and authentic you can be in this room and with your peers and colleagues around you, the more you're going to get out of it. So I hope that when it comes to self-disclosure in this room, that we can all agree that things that are private can remain within this room. If someone's sharing with you your results, let's just agree that we're going to respect that, this is an opportunity to provide feedback and to do some learning and to lean in. So I'll ask you to do that today. The other thing is, I'm going to go through some concepts quickly, as I mentioned. Please feel free to raise a hand. We've got microphones, we'll run around. I'm very happy to answer questions as we go or engage in dialogue. There will be many points on slides where I'll give you some concepts, and then I'll want to know some feedback from you and what your experiences are in your current roles and situations so that we can make this as relevant for you as possible. I've asked Brian and Jody to chime in the same way. So please feel free to engage with me. I know I'm up here on a podium, but at some point I'll probably grab a mic and be walking amongst you as well. So let's just, try to create the dialogue today. Sound good? Any questions on that? Okay. One other thing just to notice really quick, like I mentioned, extra supplies, Post-its, the emotional intelligence quiz, name tags if you want them, they're up here, extra markers, things like that. So please help yourself or whatever facilitates your note-taking and learning today. So let's get started laying some groundwork about emotional intelligence, what it is and why we care about it. So just to take a step back on EQ, or EI, you might hear it as both. It was first discovered when researchers were looking into performance. And what they found is that those with the highest level of IQs outperform those with average level IQs only 20% of the time. Whereas those with average level IQs outperform those with the highest level IQs 70% of the time. Why? Well, spoiler, enter emotional intelligence, right? Emotional intelligence was really seen at this time as the it factor related to performance, but what we know now is that it impacts a whole bunch of other things. And unlike IQ or personality, it is not static. It's not something that we're born with that doesn't change or doesn't, adapt after age 4, like some think about personality, right? EQ is something that we can absolutely develop, and that's why we're here today. So, why EQ trumps IQ, especially in the workplace? We know that emotional intelligence is a really key factor and key competency of great leaders and high potentials today. And although IQ and technical skills certainly have value, they drop as the position is higher. So what that means is that in all likelihood, your CEO has the lowest EQ in your company. Interesting, right? So what we find is that this is really a differentiator that allows people to have self-control, to lead better, to motivate others, and just be more present and connected. And so has anyone ever found themselves in this gridlock between reason and logic and emotion and feeling? Yeah? I mean, I think most of us can relate to that, and we can ping pong back and forth, and we can, kind of torture ourselves in that relationship, but that's where emotional intelligence exists. That's what we're going to work on today. So just continuing, why we care about this and what it really means to employees in the workforce, 58% of performance across all job types is accounted for by emotional intelligence. It's also approximately $1,300 in annual salary per EQ point, right? So on average, this ends up, for someone who's higher in the spectrum of emotional intelligence, it's $26,000 added to their annual salary per year. As you can see here with emotional intelligence, I mentioned in the last slide, there's lots of other things that, we're finding emotional intelligence is related to: better time management, decision making, change tolerance, stress tolerance. This is a huge one. Anger management, accountability, presentation skills, right? As you learn to relate with others and utilize those skills, right, your emotional intelligence improves these things. So I want to take a second on this quote because it's one of my favorites around emotional intelligence, and it kind of comes from one of the godfathers here of EI. Like secondhand smoke, the leakage of emotions can make a bystander an innocent casualty of someone else's toxic state. What do you think about that? Can anyone relate? Yes. Kids are actually a really great example when you think about emotional intelligence and practicing it, right? Because they often don't have very much to execute back at you, but it's really good practice ground. So what about, anything come to mind with colleagues, right? That when someone's in the heat of a moment, right? In emergency medicine, we're constantly under stress. Anyone relate to someone just spitfiring something sort of rude at you, but maybe they didn't mean to, right? But it's there. So think about that as we go through that when, you build that awareness around yourself and around others, that emotional intelligence allows you to recognize when you are in a toxic state or someone else is. So getting a layer deeper on what emotional intelligence really is and the complexity of it, what you see here is a really simple emotion spectrum. The reality is there's about 40 other degrees of emotions that fit in between all of these things. Some people might not say they're sad. They might say they're depressed or malaised or down, right? And what are the differentiators between those nuances of sadness? So what you see here is a very simple spectrum, but you can also see how that gets very complicated. And the reality is that only 36% of people can accurately identify which emotion they're feeling in a moment. Second on here is the emotional intelligence competencies. So emotional intelligence is not just one thing, which makes this a complicated thing to execute on because it's a combination of our personal and social kind of awarenesses and competencies. So we'll get a little bit more into that, but the moral of the story here is that executing with emotional intelligence is hard. It takes practice, and you have to dedicate yourself to working on that skill. So let's understand the emotional intelligence competencies. A lot of you took the quiz, and I did send you back something like this with some of the definitions, as you'll see here. So just as quick reminders, emotional intelligence allows a person to recognize your own emotions as well as others, right? That's the important part for leadership. To discriminate between your own emotions and your own feelings, being able to accurately label those, and to use that emotional information to guide your decision makings and your behavior. So quick reminders: self-awareness, being able to identify your own emotions. Self-management is using that awareness to direct your behavior. Social awareness is being aware of others' emotions, and the relationship management is how we apply others' emotions into consideration, again, when we make decisions, particularly that pertain to another person. And I also want to mention motivation here, because when we assess for emotional intelligence, and when we're going to talk about it today, we are going to focus on those four that I first mentioned. But motivation is a really important undertopic that we really could spend, a whole 90 minutes on that. So what I just want to say about motivation is that you can measure it on how motivated someone is, but what's more important is understanding what motivates a person. So I've assessed myself on this, I've got some insight, and what I know about myself, surprise, that affiliating interpersonal types of connections for me motivate me. I'm a psychologist, so I guess I would hope so. But what that means is that in the workplace, those things are like breathing to me. If I can't collaborate, if I can't engage with people, I'm not fulfilled. And I might end up, more burned out or unhappy in my position because of that, lacking performance, things like that. So as leaders, understanding what those it factors are for people, what's motivating them, can help you to understand a lens for how to lead them. So just keep that in mind. We'll touch on it a little bit later again, but keep that in mind as we work through today. When it comes to the four, self-awareness, self-management, social awareness, and relationship management, I'm wondering if any of you have examples of these from colleagues who do these things particularly well. I can tell you a story if no one does, but okay. I'll start with a story that will illustrate, I think, all four of these, just to warm us up. But I'm going to expect you guys to be giving me some content as we go. I'll let you warm up on breakfast on this one. So I had a doctor who I was working with. By the way, BPI Group works with 43% healthcare organizations, so I have worked with many over my course of my career. So I was working with a doctor who basically had a rough week and made a lot of small mistakes, and this was a dermatologist, it wasn't emergency medicine, but made a lot of sort of clumsy mistakes with patients over the course of the week. And what ended up happening is they contacted and filed complaints with the organization, and the supervisor of this physician had to basically do some performance management and came in with a little bit of a sort of stern approach, saying this is absolutely unacceptable and reminding of the performance standard, but didn't take a second to try to understand what was going on with the employee. Well, as it turned out, it was Ramadan. This employee was fasting, and this employee's wife had had a miscarriage a couple of weeks before. So if we apply emotional intelligence, if we apply a little bit of empathy, I think we can understand that maybe there were some underlying factors to these performance issues going on with this doctor and the patients. So what the manager then did, to her credit, was to be able to look at this person and say, oof, maybe I approached that wrong. I'm so sorry for your loss. How can I help? Can we talk about what will be helpful for you? Taking some time off? Do you need some leave? What's the most supportive to you? Right? So when you go through this, and I will say that it's not about not holding accountable, right? There was accountability around this as well. But when I go through this case study, I think about the self-awareness of this physician to be able to say, I'm going through some things that are probably impacting me, to be able to have the awareness to share that with the manager and to process through that willingness to be vulnerable. And for the manager to be able to manage that relationship more effectively through leaning into that understanding and around what was happening for the person, right? And building that social awareness. Sometimes social awareness does have to do with culture and religion and Ramadan, right? Maybe someone in this room can relate today as it currently is. So that was top of mind for me as I got thinking about different examples to share with you today. Now that I've shared that, do any other thoughts come to mind for folks around any of these that you want to share? Yeah.
So you're looking for examples of where using emotional intelligence and awareness would make a difference for an employee or a person in a managerial role?
I'm looking just for examples of where you think people do any of these things particularly well.
Well, an example I could give, which occurred about 15 years ago, maybe 12, 15 years ago when I was physician was recently out of residency training, so in his first couple of 1 or 2 years postgraduate, and he wasn't doing very well in the department. It was a big, busy department with a lot of expectations and demands. So we sat down, and I asked him a little bit about his what was going on in his life. And he said that you know, he had just gotten through residency, and then he wound up going through a divorce shortly thereafter. And he now was really not sure if a teaching setting was what he really wanted. He didn't really want to take on all the additional expectations of that kind of environment at this point in his career. And we talked about maybe the right move for him would be a community setting to acquire more clinical skills, build his practice, spend more time. He really actually had gotten married kind of young and hadn't really had much time on his own to enjoy his own life and determine who he was and what he wanted to do. So we worked out a very smooth transition to a setting that would be less demanding in time, more so than the clinical work itself. And it turned out to be a perfect move for him. He spent some time as a single guy, you know, in the city, subsequently went on to get married. We became lifelong friends, and I just got about a month ago an invitation from him. He was remarried now, has children. He did not have children at that time. And his son is doing a violin, he's really almost like a prodigy. He's doing a violin concert, and had I not been an ABEM examiner in early May, I couldn't go to I was very sorry not to be able to go to the concert because it was on the weekend. I was examining in Chicago. But to me, that was an example of if I had simply looked at the performance issue, it might have just looked like somebody who wasn't doing well and wasn't the right person for our department, and you know, maybe just conclude he should leave without any particular understanding of what was going on.
And thank you so much for that example. This is exactly what I mean. I know you probably all have these kinds of situations, and what a good example of how you can manage the relationship and, as a leader, help someone else come into their own self-awareness through asking the right kinds of questions and being curious on someone else's behalf. All right, so emotional intelligence, healthcare, and leadership. I want to talk about William Bridges' change curve really quick, because to me this is a little bit like Kubler-Ross's stages of grief, that we can apply these types of concepts to all different things because we're constantly going through change, we're constantly processing information and trying to, as leaders, right, better ourselves, improve our skills. And this is the basic process for how someone might navigate any type of change. And what you'll notice here is that there's sort of 3 phases: the letting go, the neutral zone, and getting into your new beginnings. And as you progress through these, there's a whole multitude of emotions that you could be experiencing, and a performance and morale dip. Often it takes extra energy, extra emotional resources, extra mental resources to adopt new information, to change, and to get into something new. So I think this is just a really important concept to think about as we lead people, because when we come up against things like resistance in performance management, this can help us to understand where someone is and to help ease them along their kind of change path to getting to acceptance and committing to it, right? Because in the healthcare field, we're dealing with change all the time. Network of providers, whether it's mergers and acquisitions. I think the healthcare landscape changes quite a bit. You've introduced electronic medical records. You know, all of those kinds of things impact your climate in healthcare today. So I'm curious about what else is driving change in your organizations today that's impacting you as a leader. Yeah.
That's coming fast.
So what we had there was fast growth across different kinds of environments. I'm repeating for our recording here. Thank you. Yeah, that's absolutely, I think, the case going on with a lot of different businesses. What else is impacting you?
I'm finding the millennial generation has different priorities for the academic environment that we've traditionally built on with journals and somewhat textbooks and academic promotion. Now it's much more about if you have a microphone and a computer, you can make your own podcast. Who needs the journals? Who needs the academic rigor? And so it's very difficult to motivate newer faculty on that basis.
Interesting. Thanks for sharing. What else? And thank you for sharing these. This just helps us to, have some context for what's going on for all of you so that we can make these conversations about you as we go on. Go ahead.
Just because the last comment was about millennials, as a millennial physician, I find that my people above me in the hierarchy often have very different ideas about what priorities are around family life and balance. And so, I recently had a child, and I was discussing the difficulties and changes that come with that. And the person I was talking to, all but said, "But don't you have a wife to deal with that stuff?"
Oh, right. And so you bring to point actually some gender differences and also age differences that come with emotional intelligence. And what they've found around self-management in particular is that this is a skill as part of emotional intelligence that really develops based on age, or that's what it sort of looks like, because the older generation seem to have a bit more of this, and when you look at the cross-section of age, it also tends to develop. Any others?
Jessica, I would just say, so we're all under, I don't know an institution that isn't under major budget stressors and having to either downsize or, cut positions or make some changes that where good ideas or creativity can get nixed because there's just not the budget for it. So it's kind of a frustrating situation for people to be in who are trying to move things forward. If any of you are not in that situation, I would raise your hand because you should be congratulated on your institution.
Anyone?
Really. So
Ooh,
Ted
one
says we're
person
not
in the
that
room
situation, so, yeah.
has funding. Yeah, and as leaders, that becomes really hard to develop your high potentials and things like that, as well as if you don't have, funding and training even for yourself, the experience and ability to be able to do that. So thank you for sharing all of those things. I want to just quickly share a couple of research articles that were done on basically why EQ matters in medicine. So one of them looked at the impact of positivity on physicians in making correct diagnoses. They looked at 3 groups. One of them was the control, one of them was exposed to positive statements before they began the task, and one of them was given a surprise gift, a piece of candy. What they found is that those exposed to the positive statement or the surprise gift came to the correct diagnosis 20% faster and showed 2.5 times less anchoring. So they weren't so fixated on, the original information provided by the patient. They were able to engage with them and, through that sort of positive psychology there. The other study that is shown here looked at disruptive behaviors as linked to adverse, impacts on patients in hospitals. And what this found, and I will just note that this is sort of a self-report reflection of nurses and staff in hospitals that were surveyed following disruptive, behaviors or things happening in their environment or poor outcomes. And what it found is that 71% felt that disruptive behaviors were linked to medical errors, and 27% felt that disruptive behaviors were linked to patient mortality. That's a pretty huge number, right? Even if with EQ we could adjust that by 10%, that's huge, right? And 18% reported that they were aware of a specific adverse event that occurred because of a disruptive behavior. So again, that's 18%, and if you multiply that across, all of the medical environments we have, even just in this country, that's a lot. Bottom line here with this other study, retention is linked to leadership behavior. As physicians, as leaders, your behavior impacts your direct reports, your nurses, your residents, right? Has anybody ever heard the kind of quote or saying that people leave managers, not organizations? People leave their bosses, not their companies? That's, yeah, right, I'm seeing some head nods because that's what this is about. And we know now that culture and environment and things like that also certainly play a role in that. But retention is linked to leadership, yes.
Could you clarify what you mean by disruptive behavior in this context?
So it could be a variety of disruptive behaviors, but mainly the disruptive behaviors were related to, I think, verbal interactions between people that, or distraction, things like that, that were going on in the environments. It could have been a number of different things within this particular study. Does that help? Okay, so thinking through some of your leadership challenges, these are some of the ones that I hear. Oh, sorry. Missed a question?
Well, I just wanted to add something that I think is particularly relevant for us in medicine, in the clinical practice of medicine. You know, when it comes to disruptive behavior, most of us can identify other person's behaviors that seems to be adversely affecting our experience. Mm-hmm. But for the person who is putting the behavior out there, it's often a blind spot that it's occurring. And the, you know, it's said that the words you choose are a relatively small percentage of what gets experienced by someone else, maybe 5–10%. The tone of your voice is another 30–40%, and the body language is the rest of it. Yep. So people are often unaware. There's like a blind spot with regard to the tone of their voice and their body language. They may know what words they used, and why I bring this up is that we often look at this as it affects other healthcare persons, but it also, I believe, has an adverse effect on what information you get back from a patient when you're taking a history. And we all recognize that history still remains a foundational component of being able to make a correct diagnosis, or at least move in the correct direction, even if we can't ultimately come to a specific diagnosis. And I think with an unawareness, in that we were saying self-awareness as part of EQ, with an unawareness, one doesn't realize that you could be actually obtaining less or incomplete information from a patient, and that, like I'm the owner of the information I get back, we tend to think it's up to the patient or sort of blame them for not telling us something. So I think that's where EQ also comes in.
Absolutely, and back to this one, right, where we're talking about if we go into a conversation starting with a positive mindset. I love that example of what might I get more from the patient if I approach them in a certain way. This stuff applies top-down, multi-directionally, and with this group you absolutely have to think about you as the leader, your employees, as well as the patients, right? So you have a complex relationship spectrum potentially to be managing. So leadership challenges. I really want to hear from you what some of your challenges are in terms of executing on your own emotional intelligence. You guys have already given me some examples for how you do this, but what gets in the way of you being able to be that present and emotionally intelligent leader? Stress, anyone? Doesn't impact anyone in here? No, not me.
I can break the ice again.
Okay.
So I would just make the observation. I think in the clinical setting, we actually become, we've seen thousands of patients and families in these kind of heightened emotional states. And I think over time, we usually get pretty good at perceiving even subtle emotional states. But where I think we come up short is recognizing our own emotions, because in that clinical environment, we often have to suppress it. And so I think it can just kind of become your way of operating when you're in other states, whether they're people where there's emotional heightening, and you may, again, you're suppressing your own state, which I think is a contributor, obviously, to burnout. And I just think it's something that it's kind of in our training, and you have to be conscious of it as you are in the non-clinical setting.
Yeah, that's such a great point, right? We're told that we should compartmentalize, or we kind of need to, especially sometimes, to act in an emergency kind of situation. So that really plays into leadership capability and bandwidth, right? Do you have that capacity to be able to have that presence for other people? Some of the others, right? Navigating your own emotions versus leading others through them, dealing with ambiguity, especially around change. If you're frustrated with the change going on in your organization, sometimes it's hard to, put that aside in order to get the rest of your team on board with what's going on. Anything else anyone wants to mention quickly that's impacting you as a leader? Can you say that again?
Time pressures. I feel like there's
Yes.
clinical work, research work, and as you pile more and more things, sometimes all right, well, I have 5 minutes for this meeting, and then I have to run to the next meeting across campus, starts to cut into your ability to be fully present.
Absolutely. Deadlines and things like that, being having to be or feeling like you need to be in multiple places at once can really have an impact. Any others before we move into our strategies? Anyone wants to share? Okay. So for this next section, I'm going to fly through some concepts pretty quickly. The idea is that I'm going to give you some frameworks, some ideas as starting points for you to take moving forward. There's some exercises laid out in here. We're not going to have time to do them all, but the idea is that we'll give you frameworks to be able to practice with each other, to practice with your direct reports moving forward. So this is sort of the EQ toolbox in the way I think about it, and you all have alluded already to lots of this stuff. We need to have insight to execute on our EQ. We need to have insight about ourselves, right? To know what our baseline is and to know what we're like when we're under distress. We need to have the right mindset. We need to be able to adopt a flexible and positive mindset to be able to execute in this way. And we also need self-management skills, right? That's really critical to being able to manage your own emotions and then to take that next step into being able to separate that, the you, from the other, and how we lead others moving forward. So I've mentioned stress a couple of times. Stress is really critical to understand when it comes to emotional intelligence, because what happens when we're under stress is that our capacity it decreases, right? And we're not able to manage our emotions quite as well as we maybe normally would. How many of you feel stress in your job on a daily basis? Anyone? Right, so we have to be aware of how this impacts us. I think especially in emergent environments, because we can, sort of learn these things about ourselves to help ease ourselves one way or another. So this is Richard Lazarus's eustress model. And I love this model because it reminds me of the biological purpose of stress, which was, kind of survival, right? Fight or flight. When that saber-toothed tiger is going to come and get us, boom, we had a stress response that allowed us to survive and to act and, to try to survive, right? And stress has taken a different form in our modernized society today, but we still get that adrenaline and we still get that stress response and the cortisol going in our bodies, and, we still feel it. And what happens with stress is it sort of motivates our actions. So with this model, what you see is performance and the level of stress. What happens is eustress means good stress. And when the appropriate amount of pressure is applied to a situation, you can function optimally. When you have things added once you're in eustress, you might dump over into distress. If you don't have enough stress, you might be in the calm, which means maybe you don't have a deadline for something, right? So you're not quite motivated to get it done. So you can kind of see the spectrum of stress here, and that What happens to performance in the calm or in the distress is that our ability to perform diminishes. Can anyone see this? Can anyone relate to, hey, I had this time where I know I was in eustress because, man, I could just get in there and get it done. Yeah. Versus what happens when you dump over into distress. I think most of us can immediately feel that when we start to, experience more and more stress being piled on. So what are the things that you notice about yourself when you end up starting to feel distressed? What are your signals? Something happen in your body, in your mind, you lose focus? Yeah.
But you can't, just nothing seems to work out in your favor at that time.
Yeah, you can end up spinning your wheels because you can't concentrate or focus on what's going on right. What are things that others notice when they get into a sort of distressed state? Any others?
Anyone notice sleep disturbance?
Yes.
Which I think we're inherently with our regular shift work, we're prone to that anyway, and so you add a little stress and you're not sleeping, and then that throws everything else off.
Yep.
Not that I've experienced that, but
Right. Never. What about, I just want to throw this out there, any procrastinators in the room? Hello, I am one, and I'll own it, and let me tell you why. It's because I don't have the applied pressure. If someone gives me an assignment and not a deadline, guess what? That's probably never getting done, right? Because for me, with all the inputs, all the things going on in my life, all the stressors that I have, if you don't give me an expectation of when, I'm in that calm and I'm probably not performing at my best for you. So insight, right? We're talking about building insight about ourselves, self-awareness, and understanding how we perform when we're under stress. Because as the examples were shared, when we can manage our own stress and insight first, we can better help others through as well. So this insight portion I'm going to talk about as it applies to you, but know that you can take these kinds of concepts and also apply them to your direct reports, your colleagues, and people around you. The iceberg. I'm sure lots of you have seen something around an iceberg before, right? And this idea of what's above the surface and what's beneath, and that 70% of what's going on is kind of underneath the surface for a person. And someone mentioned blind spot, right? So I'll mention the Joe Harry window kind of famously as this model that looks at expanding your window of what is known to you and what is known to others, right? That there are things that are unknown to us about ourselves, and there are things that, others can help us to fill in on that window through things like feedback. But the important thing to keep in mind here with the iceberg is just that there's a lot going on for people, that we're complex, that we think we compartmentalize, but we don't always do that very well. So thinking about insight and mindset, getting into self-esteem and perception is kind of important. So many of you have probably seen this kitty cat looking in the mirror, and what he sees back is a lion. That's his self-perception. It might not be how other people view him. So what we have here is the intersection between who we want to be, who I am, and how others see me. And I think this is particularly important in emergency medicine and in leadership, particularly when leaders, and I think a lot of physicians, have a directing leadership style. You're really strong in the executive functioning and the critical thinking, but sometimes something like this can be, looked at overcritically as, one sort of facet going on for you. But I'm wondering if anyone has this experience where maybe that critical thinking ability is misperceived as something like rigidity. Anyone relate? A few head nods. Right, so keep that in mind as we move forward. Another thing I want to remind you, which you'll probably remember from your Psych 101 class, is around locus of control. Internal locus of control, meaning you can manifest things, that you make things happen. External locus of control is the mindset, basically, that things happen to you. So I think about control as a really critical concept in medicine because you need to have a sterile environment. You need to have the tools around you, the things on hand to assist you to get your job well done. You have to, right? There's a certain amount of control that you need within this environment. And also as you think about, leading residents and what that requires to really teach someone in the right way. So this is your reminder that you should just take note of where you are in terms of your locus of control, because as a leader, it's your responsibility to create those best working conditions for you and your team to be successful. So note your default here because it could be impacting how you're approaching leading others. Leaning into mindset. I want to talk about growth mindset, which is brought to you by Carol Lueck. So what she looks at is the contrast between a fixed mindset and the growth mindset. In the fixed mindset, people believe that their basic qualities, their intelligence, their IQ, their EQ, their personality, and their talent are fixed traits. They believe that they're born with these things and those things alone will contribute to their success. And so they spend their times doing a lot of things like documenting how they're being intelligent or successful in the world, instead of on the contrast where we have growth mindset, where people look at things as an opportunity to improve. They believe that their talent and their intelligence is just a starting point for where they can go and what they can build into. So what I really like about this model, the big takeaway for me, is that this shows our constraints that we put on ourselves are really perceptions that sometimes we need to work through to challenge ourselves to take that growth mindset instead of being sort of stuck in what we're doing and the routine. And I think it's really easy to just get into the routine of things and to not challenge ourselves to move forward. Self-management. So we're transitioning onto that third bubble of our toolkit here in self-management. Where are you at? I like this guy on the fence because he's sitting there on purpose, questioning. And he's going to make a decision to intentionally engage or intentionally disengage. So when it comes to, the first piece of EQ, we really want to check in with ourselves, pause, assess the situation, and ask yourself some questions. Does this situation require immediate attention? Sometimes your answer is going to be yes, in which case you might not have a lot of time to pause. But when you do have the time, exercising this pause, taking a step back, challenging yourself, whether it's something you need to engage in or not, is important so that you can take some time to think about your approach. Effective listening. So as this gentleman mentioned, there are lots of ways that we can listen. There are lots of ways also, therefore, that we can misinterpret and confuse information. So we have thoughts, emotions, motives, and values, that body language that's really important. All of these things are present when we are having a conversation with someone or communicating. And it provides us a lot of opportunities, unfortunately, to miss the boat on that. So this is a practice in here on reflective listening that I encourage you to take, moving forward with someone to practice, because what you do is you have someone tell you a story and you reflect it back to them in your own words, not using what they said. And what happens in this typically in just reflecting back to someone is they feel heard and they might give you some more information. So I'm sure that a lot of you probably use this as you're collecting medical histories and things like that, where you reflect things back to ensure understanding, and then you might ask a follow-up open-ended kind of question, right? Familiar concepts? Yeah? Okay.
Hey, Jessica, would you mind going back just for a moment to the fence slide? The one.
Oh, yeah.
So Sue and I were just here whispering a little bit, just that, you're talking about the individual, but if you're managing a group of faculty, you're going to have people in those three camps. And anytime you're doing a change initiative or just in general to try to get your department in the most positive functional state that you can, you want to get those fence sitters moving toward the actively engaged. And you will be able to identify those people who are actively disengaged, and then as we the Jim Collins thing, are they the right people on your bus or not? And so
Yes.
this applies to you leading groups of people as well as yourself.
Yeah, thank you for that, Brian. Absolutely. I know I'm moving quickly here, so please feel free to chime in as we go. But I want to just mention briefly defense mechanisms. The SARA model is your typical responses to feedback. Can anyone relate to any of these coming up for them? Shock, anger, resistance, finally to acceptance, right? Sometimes when we get feedback, it's a little bit hard to swallow. So what helps you work through those defense mechanisms when you get them? Yeah.
So this is something that this is something that I teach my residents. But I actually noticed that you kind of go through the same stages of grieving. So this is a different model. But as the stages of grief, I tell them to try to, and I practice this myself too, to turn them on their head. So instead of denying that, can't believe this is correct. Instead of denying, not accept the feedback, but accept that I am receiving feedback. All you have to do is accept that you're receiving feedback. And then instead of anger, thankfulness that you have someone who cares enough about you to give you good feedback, because that is so rare and so valuable. And then instead of bargaining, look objectively at circumstances and see, what is it that happened and what might be their perspective. And then instead of depression, optimism, that I can use this to change, and that's very much in line with what mindset.
Yes.
And then ultimately, not just acceptance, which is the last stage, but a plan to move forward how you will move this. So that's something that I found useful because I noticed giving feedback or receiving feedback that you tend to go through some of those stages. And often residents will get stuck in one stage, like the anger or depression for a long time after they receive several other feedback. So that's something that I found.
Absolutely. Thank you so much for that example, because I think that's so poignant and true that we go through these processes. I think there's another hand up back here.
Not sure I can talk loud enough.
Oh, gotcha.
So I do a lot of feedback for quality improvement, and so I'm sort of on the end of, getting this kind of defense mechanisms. And so what I found and I've learned from my psychology collaborators is sticking to the facts, and also you have to prepare yourself for the defensive reaction of the person sitting in front of you. So if you're better prepared, then you're less likely to sort of, lose your EQ and kind of get involved in the emotional discussion. So just kind of keeping it factual and also, recognizing that you're going to have some emotions in response and just kind of keeping things calm has been very helpful.
Yep. Yeah, thanks for that. There are lots of models around giving good feedback, and I've skipped ahead a few here just because the conversation took us there. I'll backtrack a little bit, but I just want to point out there are really simple feedback models that you can utilize to provide that information to people. And I loved what you said, that feedback is a gift. I have this colleague who always says that, and even when it's opportunity feedback, she looks at the person and she says thank you. Even when the feedback is frankly not delivered with very much emotional intelligence or tact, she looks at the person and she says thank you. And then she goes on her way to digest it, right? And not all feedback we're going to take and go, okay, I'm going to change this element of myself. That's a choice that we can make. But it's still an opportunity for us to see ourselves through a different lens from someone else. And I really like that thought of approaching feedback with gratitude, both when we provide it and when we receive it. So what happens when we don't give feedback? Right. You think that everything is okay with your performance. And so if you don't get it, think everything's fine with what's going on for me, and if you don't give it, you never give your direct report the opportunity to improve. And so you can do that very simply. So I'll just give you an example, opportunity feedback. Brian, I'm going to use you. Brian, when you show up late, it makes me really nervous. Could you please show up on time? Okay, that's a really simple example, and you can elaborate, a little bit more, right? It makes me nervous because I'm worried we won't start on time or something like that, but it's a very simple, this is the action that I'm observing. It impacts me how, I'm owning that, and so could you please X? This is my request of you. And either that will open more dialogue, or he'll say, oh yeah, I didn't realize that, or, hey, I'm really sorry, and there's an opportunity for accountability and relationship management there, right? So it won't impact us moving forward. I love that. So thank you on the feedback. Yeah?
So I'm curious about this, because it personalizes it in a way that actually seems to create almost more attention versus depersonalizing that feedback. I'm wondering if you have thoughts about that.
So the question is related to, because this model will personalize it to me, saying that this had an impact for me, right? So when you look at Lencioni and you think about trust and relationships and how you build on that, using I statements and taking a personal lens and allowing that vulnerability is actually the best way to manage relationships if they matter. So if you are in a situation where you're heated giving the feedback and you're going to take it personally how the conversation goes, maybe you need to take that step back in the moment and approach the feedback at a later time. So I think that's generally what I've found in the research that I've done around, feedback and trust and how we build relationships is really about owning what the impact is. Yeah.
I've seen this go in so many directions over the years, giving feedback and how to do it correctly.
Yep.
I'm still, and I think you have to, well, I've seen this happen in so many different ways, giving feedback. There seems to be a wave of people talking about this that are really convinced that the most honest feedback is always the best. And although I agree with that, I think using some of these keys are so important. And I point to a couple things. There was a really nice paper in HBR just last month by Marcus Buckingham talking about the fallacy of feedback. And he really talked about if you're just trying to be, if your stick is that you want to be brutally honest, and that's what you want to do, and I've seen faculty get bad evaluations from residents because they're brutally honest, and that's their badge. They're happy about that. That's their bragging rights. They can be brutally honest and put people in their place. I think there's two issues with that. One is, to your point with Lencioni, there's no trust development between people, so there's no context. So they don't know that you're doing this to help them in the long run. So that's one big problem that I think they miss. The other problem is, and it goes to the paper that the HBR paper last month that Buckingham wrote, and the fallacy that he was talking about is our performances are based on our perceptions of how good or bad we are, and not necessarily what's right or correct by any measurement. So when we try to judge how well a learner is doing, or somebody, a faculty member, it's our perception. So that's why it makes me, those kind of starting points are really important. Otherwise, the direct, honest feedback without context, without trust, in what he gets to in his paper is it just promotes a toxic environment, so which nobody learns.
Right, and so this plays into, I think, in workplace culture as well, how we approach trust, how we approach teaming and collaboration. And this is a feedback model. This is not just meant for your direct reports. This is colleague to colleague. This is managing up. You can use this. If you go to your next slide, I've got 6 steps to performance management, which this is more about providing that kind of performance feedback. And I just want to tell you the #1 mistake I see leaders make when it comes to delivering performance feedback is allowing the individual they're speaking to redirect the conversation somewhere else, to make the conversation about something else completely different. So when it comes to this model, just really quick to go through it, Clearly state what you have personally observed, or sometimes this might be reports to you, but you need to state it clearly to the person and wait for them to respond, give you some sort of explanation, and then remind them of their goal or the performance standard, what the expectation is. This is a standard. That part is not about you, right? This is giving feedback that's very straightforward around performance and what the expectations are. And this might be where people try to sidetrack you, right? Where they're trying to avoid a little bit of the accountability around where they're not meeting that standard. So you need to redirect them. Okay, we can talk about that later, but right now we're discussing X. We're discussing the fact that you've been late 3 times this week. So what are we going to do to address that issue? And you have to agree on the best solution with them. If you've tried it before, challenge them on that and feel like you're leaving with something from them that actually could work to solve the situation. Then you need to follow through to ensure success. That means that there are consequences to people's actions. We live in an adult world. That's how things work. And also that there's positive reinforcement when things are, improved and someone does meet the performance standard, right? So feedback is complicated, and there are certainly different ways to give it. And I do think relationship is really important with feedback. And if you're trying to build trust, to approach it in a way that honors the relationship is critical. Okay, feedback. I want to jump back to a couple of slides around how we lead. I want to acknowledge that in this room we have a baseline understanding probably of how emotions work. Sorry, am I moving on?
Well, I just wanted to add one thing that well, for me, in my experience, I've found very important in providing feedback, and that is first to make sure that we're on the same page with regard to what the game is that we're playing. And I use the word game, it's sort of a sports analogy, but the idea being if you're playing football, you don't get to bring a baseball bat on the football field. And so you have to know what game you're playing and then what are the rules of the game. There have to be some agreement that this is the game in the emergency department. Part of that game might be that our behaviors exhibit compassion or kindness or caring. So if you're very successful in tasks, like you can put a central line in very quickly, or you're really good at suturing, but your behaviors are such that people are left with an experience of you being rude or mean. Well, part of the game, again in baseball, the rule is you get 3 swings, not 4 or 5, and you don't get to make up your rules. So I like to first make sure people understand what is the game we're playing. Are you clear about that? And then these are the rules by which that game is played, and this is what's been observed, which doesn't fit with those rules and with those core values when I say game. And I then like to bring in a coaching model where I say, look, as your coach, I'm here really to coach you to succeed. But you can't succeed playing a game that you've invented that isn't the game being played by the organization, the department, and the rest of your teammates. So I can't coach you for success in that situation. I even invite people to consider going somewhere else where maybe the game they're playing is actually the game that the department is playing. I said, maybe there's a department where being rude is a core value, in which case you will be a star player.
Or
I've actually said that to people.
Right, or that's the cultural norm, and that's how people are allowed to behave. So you brought up a couple of really good points from one of the slides I had prepared. Basically, people need specific things from their leaders. They need things from you. They need positive reinforcement in the form of praise and recognition, and they need a clear understanding of what's expected of them, right? They need to know the rules to the game. So as a leader, you need to provide that communication. You need to provide adequate working conditions for them to be successful, and you need to provide appropriate recourse, hence the feedback that we talked about, right? So just really quickly, we've all felt and experienced resistance. What do you do to manage it, within yourself or within others? What do you do when you feel yourself going yuck against something that someone's telling you, but you know you have to get on board? Do you listen? Right? Take in the information, right? To try to get through and to navigate resistance, you might get into that active listening, holding space for other people, communicating more, asking questions, giving feedback, sharing insight, taking feedback, helping another person identify what their disruptive feelings are about, for example, could help them move through that, right? These are all examples that you've all talked about as we've moved through our conversations today so far. So as we think about managing resistance, think about this idea of personalized leadership through understanding motivation. This is where I'm getting back to that motivation topic. And what you see here is that you have performance and time and the want to versus the have to. And that is the discretionary effort that we all want to get out of our employees, right? Especially in those client-facing roles. So the key often to cracking that code is in understanding what motivates someone, what's driving them. Brian and I talked about an example for recruiting, and he mentioned this earlier around getting the right people on the bus. And that's really your responsibility as the leader. It's not your job to provide intrinsic motivation for other people, but it's your job to find those folks, hiring the right people, and holding them to your performance standards, to the rules of the game. Okay? So I want to skip into our next section here. Around your own emotional intelligence questionnaire. And I just want to have you spend a couple of minutes with the materials in front of you. You should have gotten your EQ scorecard, or you will have taken this in the room. And I want you to look at your results and take a couple of minutes to just jot down some initial thoughts about your own emotional intelligence. And I'll kind of walk around the room as I have you do this, but there's a couple of guiding questions that are provided for you here and some note space. So think about your self-awareness, your self-management, and these components, and maybe write down a couple of the things that you know impact your motivation. Okay, so I'm going to give you a couple of minutes to just think through what your results say, and I'll walk around the room here as we do that, okay? So just a couple of reminders, though, that this quiz just gives you a baseline. It's a self-report measure, and to really understand the complexity of your emotional intelligence and how others perceive you, you know, more assessments, 360s, and feedback also becomes an important part of this. Okay, so we'll give you a couple minutes, and then after this, we'll spend the rest of our time looking at case studies, okay? right, any thoughts or questions or takeaways, aha moments that anyone wants to share out with the group about, taking the emotional intelligence quiz, or any, insights that they've gained since thinking more about this topic? I know some of this is sort of a private thing to digest and to move through, so no pressure there, just wanted to ask. I encourage you to continue to process through. Yeah, we've got one up there. Yes, absolutely agree. This is where 360 assessments and getting, feedback from others on how they experience you is really important. And I know you had mentioned that to me earlier. I had some conversations with folks prior to starting this, and getting that 360 evaluation, and particularly making sense of it when there's, divergent kind of information or things that don't align, can also be really important to this. So yes, this is a self-assessment. And your own insight, if it is limited, can absolutely impact your results here. Yes?
During my life at this very moment, my self-management wasn't as high as it used to be, and we had a new CEO and a new CFO that have come into our hospital and practice group that has no academic experience. And so I find myself going into these meetings angry, defending, trying to manage them, where I feel like that if I took the time maybe to prepare a little better, on the second question, it's like, what would you do to try to, your weakest one? Yeah. If I could prepare a little better, try to figure out what I want the outcomes to be, not get as emotional. I feel like I'm defending academics all the way, where all he wants to talk about are work reviews. And what are you doing? And so I think that it's just timing, because I've noticed that my self-management has been better in the past, but right now it's not great.
Yeah, absolutely, right. The environments and situations we find ourselves routinely in can impact how we're managing, and I would argue that this is a stressor, an additional stressor that's being put on you, that your behavior then is kind of being pushed into that distress kind of zone. And so if you can take that example, take that pause, take that step back, and be more planful to get yourself into eustress and your optimal performance and how you want to be as a leader, right? Because we're here because we care about how we lead others, and the impact that we have. So that's a great example. Thanks so much for sharing. Any others? No? All right, we're going to spend the rest of our time looking at case studies here. So I'm wondering if someone will volunteer to read this one. And what we're going to do instead of at our table groups is we're just going to process this one as a group. We've got 2 case studies to do. Can someone read this for me? You're not sick of hearing me talk? Anyone? No? All right, I'll do it then. Twist my arm. You are an emergency medicine attending physician. An 85-year-old woman is seen by a second-year emergency medicine resident in your busy emergency department. She has major vascular disease and abdominal pain. The resident presents the case, and you agree that a CT scan of the abdomen should be ordered. When you examine the patient, you are more concerned that the resident that something bad is going on with the patient. The CT scan shows severe mesenteric ischemia. I'm not a doctor, sorry. With much of the bowel appearing dead. The resident breaks the news to the family. The patient's son then angrily approaches you shouting, "This other doctor," the resident, "said that my mother was going to be just fine and would probably be able to go home later. Now he tells me that my mom's gut is dead and she might die from it. What is going on here? Doesn't that doctor know what they're talking about? Aren't you in charge here? We aren't prepared for this," right? So anyone relate to this case study? Right, having to go kind of clean up unintentional messes maybe of residents sometimes, or even of colleagues. So let's think about what you do in that situation. When you are that emergency medicine attending physician. And in this situation, what are you feeling in that moment where this, patient's son is coming at you for answers? What's going on for you? Yeah.
I feel a lot of compassion for the son and his family because it's very difficult to process all of the information coming at you if you're a patient's family member, if you are not in healthcare. And so I kind of start there and say, let's sit down, let's talk about this, and maybe even going to why this is a difficult diagnosis to make, and it's often, it can be unexpected, and that's probably why the resident said that. And get a social worker to help. I mean, I would call in my troops to help provide some emotional support too.
Right, so you're going into that relationship management, managing with social awareness and empathy and those kinds of things as you are approaching this situation. And you're providing a little bit of information to the patient to explain how this outcome, might have happened, how this miscommunication potentially took place. What about others of you? All right, we got 2 mics at once. Fight for it.
Thank you. Since we're talking about emotional intelligence and self-awareness, I'll be honest, my first reaction probably is defensive, that they're attacking me. I'm quickly suppressing that in favor of something one of my medical school professors told me: when people feel bad, they behave badly, and more empathy. But my first reaction to this case scenario was probably defensive at first.
Right, and maybe frustration too, right? What else?
There we go. All right. And so defensive is actually not the wrong response here, because as the case scenario is presented, this is somebody who might actually physically be violent. While you're going to start working with de-escalation techniques, you need to be aware of the fact that there's a real possibility for violence in the emergency department setting. So while de-escalation is one thing, boundary setting is another. And so many emergency departments, my own among them, have behavior policies for visitors, and this guy is rapidly approaching that limit.
Mm-hmm. I love that and appreciate that point, right? Because you have to rely on your own sort of gut and that intelligence telling you in the moment when you're safe. And as you see the kind of questions progressing through, and what you do with your body language, and what do you do if the son gets more upset, he threatens to sue, and those kinds of things. Again, as you build on the layers of how intense this can be, what else is going on for you? Please share, and then I want to transition into what else you do. What do you do with your body language, and what do you say to the son to help move through?
So my comment might have applied a little bit better earlier, but
that's fine.
I think my initial reaction was a combination of everything that was said already, with the idea being if somebody is escalating in their behavior, first question is, am I safe? Is my staff safe? And the second question is, why are they angry, and getting a read? Is this somebody who will fly off the handle and start throwing punches? Is this somebody who's just emotionally distraught and is trying to intellectualize through the difference in the information they heard an hour ago versus now? Is this somebody who's just looking for answers and really their heart is hurting? And letting them talk a little bit while I sort of scan the room and figure out where the doors are and where's security. And then try to figure out what they need as the next sentence, depending on my general read of where they are.
Yes. And we're teetering on this thought around mixed emotions, and that we sometimes are feeling a variety of things and have to pick one in order to, act in the right way, right? So if we're having empathy, frustration, we're upset in different ways, right? That when it comes to managing the patient, a lot of you are talking about managing with de-escalation, managing with some empathy, and certainly keeping safety in mind first and foremost of, you and your staff and the environment. So what else do you do? Anybody have a good example of what they would say in a situation like this? And if you could embody that and show us what your body language would be like too, that's helpful. Any thoughts?
I have a microphone. I'm going to answer that question, I hope.
Perfect.
So I agree with the comments that were made, which is this is not about being upset with the residents. that they earlier said she was going to go home. This is my mother's going to die. And so quite frankly, I wouldn't even really address the resident what they said before. I would say something like, this is really shocking, and it's really sad when you get news like this, that your mom is this sick, period.
Yeah.
Like, that's what this is about. And then stop and listen and let them reflect, because they can't, people can't process the cognitive information until they get through their emotions. And so I think you need to address what's really happening here, which is his mother is going to die, and he's sad about that.
Absolutely well said. And I agree, sometimes really less is more, especially when we're communicating in an emotionally charged kind of situation. So, all right, I think we have a pretty good handle on this case study. If there's nothing else anyone really needs to add, I'd love to respect the time and move on to our second one, which will get you into trios and role-playing a little bit to put some of these feedback models and the different strategies we've talked about and that are in your books for you, putting them into practice and real life. So. Let's move on to the leadership role play. Does anyone want to read this one? There's no tricky language in this one. All right, just me. You are the medical director of an emergency medical department. One of your emergency physicians, who also supervised a group of residents, has been having performance issues recently, and you need to get to a solution quickly before this puts someone at risk. You've observed him or her directly or received evaluation reports that tell you that they're consistently arriving late, not managing the ED well during their shift, resulting in patient care delays and issues with unhappy patients and therefore also unhappy colleagues. They have less focus while they're on the job. They can't seem to keep up with recent protocol updates, paperwork. They often miss mandatory staff meetings as well, so they're not meeting some expectations there. But you also hear and observe that they spend extra time with patients, helping them understand their aftercare steps and maybe promoting different items that will help them. They also spend time talking with staff and regularly asking for feedback and metrics, maybe their Press-Ganey scores or things like that. You know this person to be a high-performing individual who takes pride in excellent work, but can also be interpersonally manipulative and outmaneuver people, right? So this is a complex person who might be really good at sidetracking conversations, or who might be good at derailing you, or just outmaneuvering in a way, right? So with this person, I modeled it after a specific physician I've worked with, and what would happen with him is he would regularly do the things that others would see him doing actively with patients, but the things behind the scenes he would sort of fall short on. So the idea here, and what we're going to do with this role play, is put you into 3 roles. One of you will be the medical director who needs to give some performance feedback, have a performance conversation with this person. One of you will be that person. It's your job as the employee to bring this role to life a little bit. You don't have to play it exactly the way that I said, but to provide a little bit of resistance and challenge for this leader to practice some of these conversational skills moving forward. And the third person in your group will be an observer. The observer's role is to observe and to provide some feedback to the leader in addition to the person who's playing the employee. And so then what we'll do is we'll switch. So everyone will get a turn in each of the roles. We'll do quick 5-minute, rotations to get through this. And you've got a tracking sheet next in your book. So as you're the observer, as you go through these different scenarios, you can just quick jot down some notes to help you remember some of your learnings as you move forward. Okay, so I know that many folks are at trio table groups, and I think that works for efficiency, but for those of you who aren't, if you could, find or link up with a trio, that would be great, and then decide on your first roles. Okay? Any questions on how this is supposed to work, on the instructions of this role play? Okay. I'll walk around as we get going, and I'll let you know when we're getting ready to switch and to rotate, okay? So let's have the first medical director ready to go giving some performance feedback, okay?